It's great to see so many of you gathered here today. We have over 100 registrations, which shows that there is a growing interest and a growing concern in the health sector, in civil society, on the issue of burning wood for heat or electricity generation. My organization, HEAL, brings together over 90 organizations from the health sector to work for better health through a healthier environment. For almost 2 decades, we've engaged the health sector. We've communicated and advocated for clean air everywhere, as well as for a swift transformation of our fossil fuel economies and ways of life to tackle climate change. Wood burning in private households was already on the rise before the war in Ukraine across Europe, either because people wanted to have a cozy stove or because of energy poverty. So there's very much a social dimension to wood burning. But it is also increasingly being used wood in heat or power or heat plants and hailed as a climate-friendly alternative. And certainly skyrocketing energy costs and the major shifts in energy systems that we're currently experiencing as a consequence of the war in Ukraine have led and will lead to further rise in wood burning. Also because it is promoted by many policymakers as a solution to become independent from Russian fossil fuels or fossil fuels in general. With these developments, we at HEAL felt it was high time to organize a dedicated webinar to consider the science, the links between air quality, climate, and health for wood burning. And I'm delighted that we have 4 excellent speakers this morning to provide their perspective. Professor Michał Krzyżanowski from the School of Public Health, Imperial College London, Dr. Vladka Matkovic from HEAL, Łukasz Adamkiewicz from the European Clean Air Center, and Anja Behrens from the German Alliance on Climate Change and Health. We very much want to make the exchange this morning a cross-border exchange, as the health and climate dimension of wood burning is a pan-European issue and concerns all of us. So we'll take a look especially at Poland and Germany in 2 presentations, and we'll then have short participant interventions on the UK, Sweden, and Denmark as part of our discussion at the end of the webinar. We very much want to have the exchange with you, dear participants. So I encourage you to send us your questions, your comments, your concerns in the Q&A for our discussion at the end. And before we start, a few housekeeping rules. And Jacek, if you could change the slide, please. Thanks. So there is simultaneous translation into English, Polish, and German. Please go to the bottom of your screen, click on the interpretation icon, and select the language you need and want to listen to in this webinar. If you have any questions or comments, please share them via the Q&A, which is also at the bottom of your screen. It will not be possible to use the microphone in the discussion, but we do make our best, to address all of your questions and comments at the end. If you have any technical problems, please contact my HEAL colleagues. So if you have any, comments or if you have any technical questions, contact Jacek for support in Polish, contact Elke for support in German, and contact Dalila for support in English. And you can find their names and you can chat with them in the list of panelists. This webinar will be recorded and will be published in all 3 languages afterwards on HEAL's YouTube channel for everyone to watch, and we'll hope you'll also share it further in your networks. So with that, I would like to hand over to Weronika Michałek, HEAL Poland Director, who is our co-chair, or my co-chair for this morning. Over to you, Weronika.
Dzień dobry, witam Państwa serdecznie.
Good morning, ladies and gentlemen. Welcome to today's webinar. Thank you very much for this comprehensive introduction. I wouldn't like to repeat what has already been said. I'd like to highlight the fact that wood burning question, biomass burning question is a burning question in Poland. We've been working on this for many years in Poland. We, in the sense of HEAL division, we want to inform about health issues resulting from wood burning, climate change, how it impacts health of all of us. We analyze energy sources that are available that are considered to be the energy sources of the future. We want to embark on the journey to keep a clean air, combat crisis, and in our narrative, we take into consideration all other factors, including geopolitical ones. We are exposed to the ongoing war in Ukraine, we in the sense of Poland. And in the first meeting organized in Poland, we'd like to learn about health results of wood burning and to take this new knowledge into consideration when planning the energy mix, when making strategic decisions. This is the moment when we have more questions than answers. Therefore, end-to-end analysis, including health context, is very important in order for us to take care of health of Poles and to provide energy and heat safety and security, which also translates directly into our health. Therefore, without any further ado, I'd like to pass over the microphone to Professor Michał Krzyżanowski. Anne has already introduced the speakers. I won't be repeating the list. And one thing, for those who have problems with interpretations, who were unable to understand what Anna was speaking about, let me reiterate it. You use the interpretation button, you choose the language option. Should you have any problems, contact Jacek Karaczyn, who is present in the meeting. And now the floor goes to the first speaker, Professor Michał Krzyżanowski. The floor is yours. Good morning, Veronica. Hello and welcome to all of you. This is a welcome in Polish, and the rest of the presentation will be delivered in English.
I will speak English, and because my slides are also in English, and hope you will see the slides in a second. Okay.
Yes, we can see them well. Thank you.
Thank you. So my role in this webinar, very timely webinar, is to give a few words of introduction. And I will start with something which Anna has already mentioned. We do use wood or wood residues for heating and energy production for a long time. The trend is increasing. Here you have the data for European Union countries until 2015, so it includes Great Britain. You see that wood and wood residues use for energy production has been increasing over the time, with relatively stable contribution of primary wood in this application. The other types of wood are the byproducts or residues from other forms of wood use. That is accompanied by increase in wood removals, it means production of wood from forests in various countries with various speed. On the right side, you see trends for Germany and Poland. In Germany, the use of wood has been changing over the time, but no obvious increase is seen. On the other hand, in Poland, there is steady increase in wood removals from the forest. Just for the beginning, what are the impacts of use of wood? So first, we see the growth of wood. We are happy with it. It consumes carbon monoxide, uses sunshine and water. Biomass is growing to end up in harvesting, which looks very often as industrial production of wood. Then part of this wood ends up with burning. As I said, not only the primary wood is only 1/3 of overall mass, but also wood residues and byproducts. But some of it, after combustion, clean combustion and complete combustion ends up as a carbon dioxide, which, as you know, is the primary greenhouse gas, leading to increasing the temperature. Part of this carbon monoxide returns back to the forest, to the trees, to the biomass, is sequestered by regrowth of new biomass over the time. However, part of the biomass burned ends up as pollutants of the air, like methane, black carbon, organic carbon, carbon monoxide, or hydrocarbons, which contribute also to the climate forcing, to warming of the atmosphere. So this is just to emphasize that burning wood is not such a carbon neutral exercise, but in our context, in the context of this seminar, those pollutants are those which damage human health. And we return to this in a moment. But first, I want to illustrate how much CO2 is emitted from biomass fuels. You see steady growth of CO2 emissions from biomass used, including woody biomass use. It is increasing with various speed depending on the estimates, but it has been increasing over the last decades quite significantly. And more importantly, also the balance between the CO2 emissions and sequestration is deteriorating in Europe. We are getting closer and closer to the border, which is considered to be safe. It means the forest will, if the trend continues with growing combustion, the forest will stop to be a sink on net level and will actually contribute to wood combustion and will contribute to climate deterioration, to the warming of the atmosphere. Besides the climate effects, we know about other impacts of ecosystem conditions through acidification, eutrophication, in addition to climate change. And it's not only the combustion, the direct effect of this process, but also the logging itself, transport, processing, storage. So all of this is actually quite damaging to other aspects of ecosystems and I would say just climate change and health effects. But when we look at the health effects, we measure those effects through the contribution of biofuel combustion to total PM2.5, to fine particles. There's, I would say, a part of the problem, but best recognized and very well studied. Here you have results from the modeling of contribution of various sources, in this case, this biofuel, to human exposure to PM2.5, which is directly proportional to health effects. So you see that in many countries of European Union, we have, in most countries, between 10 and 25% of the contribution to PM2.5 exposure due to combustion of wood. And for Germany and for Poland, I give numbers just for those two countries, but of course in all countries there are effects which can be measured or assessed. So the Global Burden of Disease Project estimates for 2017 amount to something like close to 4,000 attributed deaths attributed to biomass combustion, and more than 5,000 deaths in that year due to biomass combustion in Poland. This combustion occurs not only, I mean, in various locations. Part of it, a large part of it is in residential setting. In Germany, it's a bit more than half of it in residential settings. The rest is in energy production, very often in commercial electric power plants. In Poland, it is more than 2/3 of this combustion occurring in homes, in residences, which is a rather better message, because there is no technology which is screening emissions from this domestic heating, and a lot of pollutants is being produced in this residential use of wood, especially in Poland. So the questions of the seminar are very relevant. Is wood burning a safe for health, climate, and ecosystem option? Or should we rather invest in alternative, safer energy sources? And this, as was underlined in the introductory words, this very relevant question, especially now when fossil fuels become extremely expensive, and the pressure is to return to this option, which by some is claimed to be safe, but as you see, and as will be documented in this seminar, it is not really safe. So thank you very much, and I'm looking forward to the next presentations going into more details. Thank you very much.
Bardzo dziękujemy, panie profesorze, za tę prezentację wprowadzającą.
Thank you very much, Professor, for this introductory presentation. I'm sure a lot of interesting issues have been raised. I would also like to encourage everybody to follow the comments in our chat, as we could see a lot of interesting links and comments which supplement our presentations and discussions. Now I would like to give the floor to our next speaker, but Anne Stauffer, just for a word of introduction, and the floor is yours.
Thank you, Veronica. So I would like to welcome our next speaker, which is Vladka Matkovic from HEAL. Vladka is HEAL's Senior Policy Officer on health and energy, and she also had the lead on developing a briefing on biomass burning in the Western Balkans, which she'll talk to us about. So she'll follow on to what Professor Krzyżanowski said and present the health and policy perspective on wood burning. Vladka, the floor is yours.
Thank you very much, and all the welcome to the participants. Let me just share my screen. Is it okay? I hope so.
Yes, now it's in presentation, yes. Mm-hmm.
So I will be speaking on a health and policy perspective of biomass or wood burning. And I'm very glad to hear Michał's presentation before me. It was an excellent introduction to my presentation. So first of all, I would just like to mention the magnitude of the biomass burning in Europe, and the residential sector in Europe, or Europe 27 plus UK. In 2018, this is the data that we have, consisted of over 200 million households. And quite a big share of these households were using biomass for burning, around 15%. And in the EU, the use of solid fuels for heating actually is expected to persist. It is also seen now in this new crisis that people are relying on biomass burning to solve the heating problem, to solve lack of other fuels to heat the water and cook. Yeah, probably the biomass burning. Some are expecting that it will become a decade as a result of climate policy in favor of wood burning. Residential sector in Europe and UK, consumption of total energy is mainly for space heating, as you can see, like 63%. And then some percentage is for water heating and smaller percentage of cooking. And if you split this total use of energy to what is being burned or used for as a fuel, big chunk of it comes from the gas. Yellow bars, as you see in the right part of the slide. And light green is renewables and biomass. So most of the data does not really separate biomass and renewables because biomass is considered in a renewables directive as renewable energy source. So it's piled up together, even though it's very different from solar or wind, especially for health. So that's one note to make. I want to also extend a little bit the presentation, not just for European 27 or previously 28, but to other region next to European Union, and this is what the Western Balkan region. Why? Air pollution does not know the borders. So Balkan region is part of Europe. And definitely what's going on is also reflecting on air quality in European Union. And according to the Smarter Stove Partnership project, they estimated that around 3 million stoves exist in this region that are used for residential heating. And this is around roughly 42%, so a little bit less than half of the household have biomass burners at home for heating. Most of it is in rural areas, around 63%, and a little bit less in urban areas, even though it's very persistent also in urban areas, 37%. Here we come to the energy poverty topic, which is very much related to biomass burning. At least in Western Balkan region, many households keep the biomass stoves as a reserve option, in addition to some other heating sources that are often gas boilers. So this is kind of crisis option, which now proved to be maybe even an idea, not to freeze over the winter. So these stoves are mainly used in economic hardships in the moment where people are pushed over the edge into the energy poverty. So yeah, this is very big problem with the biomass and how to deal with the conversion to some other energy sources. As for European Union, recently we saw some movements on, we call it Repower EU, or European Commission call it like this, and this is basically the plan to move away from Russian fossil fuels in the light of Ukrainian war. And European Union wants to move from this fossil fuels source as of 2027, so quite soon. And it needs to act on several different topics, on saving the energy, accelerating clean energy transition, and diversifying energy sources. European Union plans to invest around over 200 billion euros by 2027 on this plan. So it needs to be very speedy plan that will deliver on basically transition from Russian fossil fuels. What's good about it is that we can see the progress. We can see that if somebody wants to make a change, this will be possible, like in making accelerating installments of solar, photovoltaic, more investments in renewables energy. But then we also have threats to diversify energy imports from other sources, so not Russian, but go for a fracked gas of the US, move towards biomass burning, which also it's not just related to air pollution, it's also related to loading and maybe overuse of the biomass and forestry. So this needs to be carefully watched for. Sources of pollution are different. As you know, they all affect health. So burning the biomass is a major contribution to air pollution in many areas in Europe, but also Western Balkan region, especially in some region like Germany, like Poland, Western Balkans. Coal is maybe the first one that is most polluting, but then biomass comes very close to it. And with this, I would like to come to the health effects of the use of biomass in heating and cooking in Europe. And Delft study of that looked at the health-related social cost of air pollution due to residential heating and cooking, prepared this report where they looked several previous years since 2018 and quantified direct and indirect cost of biomass burning in residential in households basically, and they concluded that around 29 billion euro per year now is being tagged towards the health-related costs from biomass burning in residential homes. Of this, we have also split by country, so you can see that some countries have a greater health costs related to biomass burning in total, because obviously in total they have more biomass burners. So Italy, France, Germany, Poland are leading the way. But if we look at the health cost per household, there is a little bit different list. So the list changes. So for example, Luxembourg here is spending the most per household, then Czechia, Hungary, Slovenia, and so on. You can see all of this in the report of CE Delft. I can post later on the link to the study. We also looked at biomass burning health-related costs at Western Balkan region. So I just want to mention that as well. Per country, there are also several billions to be tagged towards the health effects of biomass burning in each of the Western Balkan countries. This study was done by WHO and OECD together. So as you can see, Bosnia and Herzegovina, 5 billion, Serbia, 16 billion, and so on. Is improving the technology the solution? So there are several studies, or many studies that looked at different kind of stoves and compared it to either no stove or other stoves. And this is something that we selected as from those studies. So eco-certified stoves reduce air pollution, but still there is a big chunk of pollution coming indoor from leaking of the stoves. So even with this eco-certification, you will see the leaking of black carbon and PM in the houses, in the indoor air. So even new stoves are polluting indoor air, and all stoves should be replaced after 10 years to reduce even larger pollution. And here again, I give a little bit of percentages, how much new stoves are polluting and how much by magnitude older stoves are polluting. There is also quite a bit of talks whether dry wood would decrease the pollution, and that is true. But again, burning wood will produce pollution, so it will again leak in the homes and pollute the air. So policy recommendations from Health and Environment Alliance, or my organization, are quite clear, and these are to ensure the swift transition towards healthy and zero polluting pollution energy options for households. So focusing on zero pollution energy rather than making technological changes that will again be polluting and locking in some others polluting ways and technologies for producing the heat or energy. Always include health and environmental impact assessment to assess the effects towards the population. Invest funds and time into non-polluting energy options for households. Invest in intervention that are zero polluting and that will be contributing to energy efficiency and energy saving. So by this, we will have co-benefits in reducing energy poverty and improving the levels of comfort and well-being, of course, as well as climate benefits. And support the production of energy from renewable sources that can self-sustain households. For example, that could be solar and wind, heat pumps, geothermal, and other renewable solution.
And reminder of the time, Vlatka.
Yeah,
thank you.
Just coming to the end, and avoid false solution that would lock in the pollution. So any kind of false solution towards technologies that produce pollution and have health effects should be avoided. For health professionals, again, we encourage you to engage in shaping public opinion and awareness, produce health evidence, and engage in public debates about different forms of energy use. And with that, I'm coming to an end of my presentation. Thank you.
Thank you very much, Vlatka, for broadening our perspective here when it comes to the European region we're talking about, and also highlighting the current policy discussions and developments that we're in. And we also want to come back to those at the discussion. Thank you. Before our next speaker, I want to say we have a very active audience. That's wonderful. So please continue to share links, report studies in the chat. We'll make them available to you. And if you have questions, please use the Q&A, because that will make it easier for Ronika and I to then later distinguish. We'll also check if we can share the slides with you afterwards. And there's definitely no extra place you have to register, since we have your email addresses. And now over to you again, Ronika.
Bardzo dziękuję, Anę.
Thank
Myślę,
you,
że
Anna. I think everything is clear. If there are any technical issues,
wszelkie
don't hesitate to ask them. Any questions that are sent now will be asked in the discussion. Now, I would like to give the floor to Łukasz Adamkiewicz, our next speaker, who will share the Polish context, and he will tell us about hazards related to Poland. So, Łukasz, the floor is yours. Good morning. Welcome, ladies and gentlemen. First of all, I would like to thank you, Veronika, for your kind introduction. Today, I'm going to tell you about the most vital problem in Poland, wood biomass. This is an aggravating problem and quite a complex one.
And I'd like to feed you with the most important questions. This is the description of the state as of today and the smog period. Not only coal, but also biomass will be the main pollutant of the air and will trigger health problems. I'd like to mention about the contribution of biomass in emissions. It is a very important part of the presentation for modeling and output data. And the output data pertains to contribution. Emission coefficients, this is very important, yet briefly described. And some assessment at the end. We have seen health impact in Poland and some assessment based on these points. If we look at the emission levels, low altitude emissions, first and foremost, the one generated in households, some around 50%, 27% for coal and 21 biomass. PM 2.5, the most harmful. These are the assessments calculated by COBIZA, the institution that is responsible for emission analysis in Poland. In the slide, you can see that biomass is the second problem in the ranking. This is the problem that I'm going to refer to in my presentation. Speaking about the input data, the basis for analysis, there are two elements. First, the activity. How much biomass is burned in the context and emission coefficient. So every terajoule, cubic meter, cubic ton, how much emissions is attached to a specific unit. When we look at the percentage, 25,000 tons of particles, 30,000 terajoule is the coefficient, and the emission factor, how much emission is generated by biomass. We are speaking about modernizing the energy sources, but this is the basis for our discussion. If you can remember 200, this is the number that will be appearing in the presentation. And this equation shows that we have 21% of biomass incineration. Where do we incinerate it? In Poland, there is the old smoke generating stove production, and to replace them with the newer ones. These are the ones that use coal. This is households, 51%, but 67% of users also incinerate wood. It is all-purpose stoves which utilize 2/3 of wood. So this is the co-burning of the two. And this is fireplaces. 25% of houses have been equipped with fireplaces. 90+% of new houses have them. So this is another source of emissions. This is low altitude emission. And this emission is associated with wood burning. Biomass and coal. 2019, low altitude emissions. So this is about 10 million tons of coal. This is the latest data. Speaking about wood incineration, we're going to see calorific value later on. This is 12 million tons in total. The amount of woods in tons, the amount is almost equal to the amount of coal. So we burn a lot. Tons are then translated into this activity level, so the amount of energy that is used for heating. So this is tons and this is energy. So who are the ones who incinerate? This is the latest data from May. It was an in-depth interview of Mazowsze region. Mazowsze being the voivodeship that is the home for the capital of Poland, Warsaw. So people were asked about different things. In addition to this focus research, there was a questionnaire preceding it in January when energy prices were very high, but it was in the pre-war time. So I'm going to juxtapose it with May results. Inhabitants, representative group that responded, 33% of them use wood for heating purposes. 1 in 3 inhabitants use biomass. 36 plus 5 equals 41%. They get free of charge wood. They acquire it from their own orchard, forest, or get it free. It is very important when we speak about the amounts. In the case of Mazowsze, we don't know how much wood is incinerated because this is own sourcing, something that is not included in any calculations because it is outside the statistics. It's not included in statistics, so hardly do we know how much wood is incinerated. And in May, these people said they'll be burning wood regardless the regulations because they are short of money. Coal has become 3 times more expensive. Free wood is not more expensive. In addition to pure wood, there are other things that are incinerated, like Euro pallets, used furniture, other wooden elements. This is going to be a huge problem because this kind of wood is pretty polluted and lands in a boiler. One slide, pretty technical, but very important. This is emission factors that go into calculation. The best boilers of Eco Project are certified according to classical testing. Emissions, PMs, soothe black carbon. As the results of cooling, organic compounds are transformed into dust, into particles. It is tested at the stack outlet, and there is 200 or 400% differences. So the emissions as presented is 4 times lower than actual. So when we look at the emission factors in the models, the ones that Poland uses, based on calculation method, we are speaking about 200 on average. single-family houses 267, for coal 344. Poland has also developed its own factor. So next chart shows it. For coal, it is much lower in presentation. It should be 244, and for wood 800. So we're speaking about 200. So the presentation is 4 times lower compared to what the research shows. So the condensate was not taken into consideration. So the emission presentation is 4 times lower. We were speaking about climate policy, and climate policy in Poland and also in Europe is based
Około 60%.
on
Czyli jeśli słyszymy o
fuels, solid fuels. So if we speak about areas increase, we hear about forest removal and incineration. If the policy does not change at the European level, if we do not give up the wood burning paradigm, this contribution will be the same. Michał Krzyżanowski showed wood question very well. If we do not take this sequestration into the
emituje tyle samo.
account, the return into the forest, the emissions will be equal to the emissions from coal. Trees grow and we've got sequestration and return. If we do not keep the balance, the amount of wood that is harvested versus new forest plantation, we are going to be in the debt. And biomass was shown before. Sherpa, McDuffie, so the amount, the percentage was shown. These that I want to show, PM particles contribution. It is, the presentation is much lower. Why is that? There is a number of elements. There is no robust data with regards the biomass, bearing in mind that 50% of biomass is acquired for free. So is this a real contribution? So we don't know how much biomass is in, and the models can present lower results. And it's almost sure. We showed you emission factors table. If we couple it with the model represents the reality. However, a low altitude emissions sector produces 3 times as much. So this is 300% plus. The changes are huge. Emission factors, according to the bylaws that they normally use, why shouldn't they? They do not take into the part the condensate particles. So this is 200, 300 lower. And real life protocols, it never operates on the optimal level. So 200 up to 400 lower presentation of emissions. And when we speak about biomass, incinerated biomass is not balanced by trees. And well, it cannot be done in real time because we need dozens of years for the trees to grow. So this equation is doubtful. So bearing in mind all these elements will be presented as experts' assessment. Let me remind you that I spoke about the data. If we have 21% of biomass contribution to PM 2.5, and we use old calculations for Poland, 45,000 of deaths. This number is very important in Poland because it was used by the Supreme Auditing Chamber. The Prime Minister spoke about it. This produces 10,000 people that die prematurely. And this is just a rough estimate with regards incineration, bearing in mind all the aspects presented before. So if we speak about such a great number of people, we should pose the question, and the picture was taken not far from where I live. So the question you need to ask, is biomass a green and healthy kind of energy? Should it be promoted? And on top of that, subsidized? So this is the question that I'm leaving with you. Thank you very much, Łukasz, for this hugely interesting presentation. I hope that this will trigger substantial discussion in Poland with regards biomass incineration. There are questions, but the questions will be asked after all presentations. And now the floor goes to Anne Stauffer, who will introduce the last presentation of today. Annie, the floor is yours.
Danke, Veronika. Ja, wir richten jetzt den Blick nach Deutschland als eines auch der wichtigsten Länder, wo es ein sehr
Thank you
brennendes
very much. So let's look towards Germany. This is one of the countries where I find it very important. There is Anja Behrens with us. She is a press officer in Klimawandel, one of the organizations. She's going to speak about political situation in Germany, wood incineration problems, and health sector activities. Thank you very much. Just a moment. Let me share my screen. I hope you can see it very well. Excellent. Ladies and gentlemen, we heard about coal incineration and impact on health. Not much to add from me. Therefore, I can focus on what we can do, what kind of activities are taken up in Germany. We have had Auge Sauberluft by Klug. This is the body that is the proponent of climate protection and conservation. We know that air pollution is associated with health and climate crises. We incinerate fossil fuels and we make the air even more dirty owing to the fact that we incinerate coal. We need to improve our activities to encompass health benefits. In September last year, on an International Clean Air Day, we published our position. You can see the link, you can download it and use it if you're interested. This is where we discuss the question of energy, households, agriculture, and transport. All sectors seem to be emittents of harmful substances, no doubts about it. We can improve the activities that we are involved in order to counteract. It will be to the benefit of everybody. And now speaking about coal incineration, there are some new elements in the publication. We have calculated CO2 emissions from households. Never before have we had it. Coal has been recently treated as climate neutral because it was sequestrated by the trees. This is a wrong attitude because the burden of particle matters was not taken into consideration. This is a very important thing, much more important than many people may think. Infographics that from our presentation, from our publication, this is the distribution: gas, oil, coal boilers. So we can see there is the greatest number of gas-fired installations. In gray, 34.3 tons of emissions. Oil, not so many. Pellets, quite a few, owing to the fact that they enjoyed national and European subsidies. Fireplaces, 2.2 million tons as of last year. This is quite similar to what happening in aviation, the generation of emissions in the aviation sector. Many people use fireplaces as comfort heating, but fireplaces generate a lot when it comes to particulate matters. So what's the situation like in Germany? Speaking about Environment Protection Office, its position is that we should give up on coal burning in small installations, small stoves, fireplaces, and wood should no longer be seen climate neutral source of energy. Many things may happen pursuant to new RES directive. 33,000 euros, this is how much you can get as subsidy for pellets heating. And we know that we are suffering oil and gas crisis. Therefore, many people decide to install fireplaces. Only recently have I read that people who deliver fireplaces, they have so many clients that you need to wait for a year.
And this is the problem not only related to households, but also we need to remember that wood is burned by different energy generating entities such as power plants. The directive I have already mentioned, the directive on renewable energy, supports this kind of facilities which burn wood, and apparently we save on CO2 emissions. Mr. Habeck from the Green Party and the Minister of Climate said last year that heating with wood was a nonsense from the point of view of climate policy and energy management, that it shouldn't be subsidized and financed. We've got a number of NGOs in Germany, including our organization. We operate in this field. Our aim is to avoid using coal by power plants to generate energy, as it contributes to generating particulate matter that is then released to the air we breathe. What about the activities we do? First and foremost, we want to promote setting new limits related to air pollution. We will also share our recommendation so that possible pollution limits were similar to those promoted by WHO. We carry out consultations and organize meetings, including in Brussels. We talk to politicians and develop different materials, leaflets and brochures, which we distribute, for instance, among physicians. Moreover, we want to stop subsidizing facilities which are fueled with wood. We wrote a number of documents, and furthermore, next week, the Industrial Committee in the European Parliament is going to hold its meeting. So we're again sending letters to the members of this Commission, seeking for their support. The voting is going to be held on Tuesday or Wednesday next week. We'll be very happy to see a higher number of actors from the health care and health protection area to take part in such activities. It is extremely important that this a new decision is made on the directives on emissions. For example, we should ban subsidizing pellet burning as the source of green energy. In the slide, you can see our logo and contact data. If you feel like contacting me, you can find my email address in the slide. My presentation is a bit shorter so that we have time for discussion. Thank you very much.
Thank you very much, Anja, for this overview and for showing us also this very tangible activity that you're welcome to join indeed for this crucial vote that will happen next week. We've now reached the end of our presentations. Thank you, everyone, and we have a very active sharing in the chat, which is wonderful because it's really incredibly important to see the wealth of information that's out there. We want to, before we come to discussion, we do want to broaden our horizon again and invite 2 short participants' intervention on the situation in Sweden and in Denmark. Simon Burkett originally wanted to also present information on activities on wood burning and clean air in London. He unfortunately had to leave already, and he shared information in the chat, so which we'll also share to participants. So I first wanted to give the floor now to Ebba Malmqvist from the Swedish Air and Climate Secretariat. I see it has worked, that you can join here. And Ebba, for a short intervention from your side on the situation in Sweden and on health assessments would be very helpful. The floor is yours.
Thank you, Anna, and thank you very much for a very interesting seminar. So the situation in Sweden is that in south of Sweden, around 80% comes from transboundary pollution and maybe 50% in the north of Sweden. But the second largest emitter of PM2.5 is small-scale heating. And even in areas where transboundary air pollution is big, it can stand for 8 to 9% of the premature deaths of PM2.5. But when this is calculated, it's often calculating using estimates from epidemiological studies, and they have been looking at overall air pollution, so not wood smoking specifically. That's why it was important for us to also do studies to see PM2.5 from wood and is as toxic as the ones from traffic per unit mass. And it looks like it is. We are releasing quite a few articles coming out this summer or this autumn, looking at epidemiological studies at wood smoking, and it looks at as it is as toxic. And we have also exposed cells, for example, placenta cells, to both traffic and wood burning particles, and it also there looks as toxic. So that's my short intervention on the topic. Thank you.
Thank you very much, Ebba, and thank you for already sharing studies. And it'd be great when your studies are out if you could share them with us, and we'd be happy to also share them in this group and further beyond, because it's really important to have this information out here. Thank you. I would now like to give the floor to Kare Press Christensen. He is from Denmark, and he has also worked extensively on wood burning and the problem of wood burning in Denmark and health impacts. Kare, the floor is yours. Oh, and we can't hear you, Kare. There is a problem with your microphone.
How about now? Does it help?
Yes, now it works. Great. Yes.
Excellent. Okay. But here in Denmark, wood burning is a huge problem as well. It contributes to about 50% of our total PM2.5 emission. It's the main environmental source for premature death and morbidity. And the key challenge is not only outdoor air pollution, it is indoor air pollution as well. We have more and more studies coming out showing very high indoor air pollution levels, even in houses using brand new stoves. And this is, of course, a key challenge because we are indoor when we use the stoves, and these pollution levels are high when we go to bed, and they have spread to the entire house. So we see a huge challenge in this, and in Denmark it's widely recognized that wood burning contributes significantly to global warming as well, both due to the CO2 and due to the black carbon emission. We should not forget that. And then I'll say that even though I'm Danish, I worked a lot in the countryside, both in Hungary, in Slovakia, in Czech Republic. And of course, energy poverty is a very important dimension. But there's one thing worse than being poor, and that is being poor and sick, or poor with sick children, not having the money to give them the medical treatment they need. And this is the situation we're facing now. So for me, energy poverty is not just about keeping warm in the winter. It's about keeping warm and healthy. And there, wood burning is no solution, not at all. So we need to make sure that everybody in Europe, of course, on a global level, ideally, gets the access to clean energy. They should not be poor, and they should definitely not be poor and sick.
Thank you very much, Kara, for your intervention and for highlighting, yes, this really point that, on the double threat of poverty and illness. I'm now handing back to our co-chair, Veronica.
Bardzo dziękuję. Widzę, że pojawiają się...
Thank you very much. I can see we've got questions and comments. Some of them are asked in the Q&A. Some questions have already been answered. I would like to come back to the topic which occurred in the chat option. It was related to Professor Krzyżanowski's comment, namely wood burning, and it applies to wood which is collected in forests, and it is not included in the statistics presented by Łukasz. Currently, the Polish government has a plan to encourage the inhabitants to collect twigs in Polish forests. Łukasz referred to it in the chat, but could you comment on it now? What is the situation like? Are we really able to estimate how much wood is collected in Polish forests for heating purposes to be burnt in stoves, in the fireplaces? And what is the plan to deal with the procedure? Okay, so I reckon I'm supposed to elaborate on this question. Let me tell you about the focus research carried out in May. People acquire or buy wood directly from forests. So the brushwood is something that is a residue from logging. This is a cheap solution. As far as the estimates are concerned, it's hard to estimate because we talk about solid wood or logs. Anything that is left is not included in the statistics directly. Well, it is not described as the procedure, but as assistance to inhabitants. It's like a new scheme, Brushwood Plus, and we suppose people are going to collect it directly from wood, and this is the only type of fuel that has not been struck so hard by high prices or inflation. We should expect a high increase in this respect. There was a question in the chat, what else could be done in the context of wood? It seems we should share wood residues log, but separated from pellets. Wood pellet is also expensive, but this is low burning, low emission fuel. When it comes to households which use a lot of energy or are old ones, the cost of heating is very high or exceeds half of the value of phone. A pellet burning stove is a certain solution. However, it can be perceived as a kind of compromise. I'm sure that the wood is going to be there and is going to be still used, but still we need to remember emission levels. This winter is going to be the time of hardship, and considering the brushwood this option will be used not only in Poland, but also generally. Łukasz, thank you very much for your answer. And we'll ask the next question to our speakers.
Thank you. And I wanted to ask them to all our panelists. So it'd be great if you could turn on your camera. I think we've had an incredible wealth of information this morning, also what was being shared in the chat. And it does make me wonder why this is not, the health and the climate threats and impacts are not more of a topic, both within the public, with policymakers, but also in our health community. So I wanted to ask you, what we can do here this morning to raise awareness and to sharpen the perception that it's wood burning is not a solution. It's an unhealthy solution, first of all, and then we talk about what we concretely, what solutions would be. But first of all, what can we do to raise the awareness? And actually, I want to turn first to Anya, because there was also a question to you about the flyers, how people can get the flyers. And I think this is part of what can we do to raise awareness and get people involved, get the health sector involved.
Ja, vielen Dank. Genau, das ist unser Ansatz. Wir versuchen, über die Arztpraxen und Ärztinnen und Ärzte an die Patienten heranzutreten. Es gibt ja inzwischen auch...
Thank you very much. We distribute our leaflets in physicians and outpatient clinics to make patients aware. We want to organize what we call climate consultations, or simply during an appointment at the doctor, people should be informed about wood burning, climate and air pollution. Our objective is to raise awareness about the consequences of wood burning. It should be equal to the awareness related to the consequences of smoking, because these consequences are quite similar. Unfortunately, we could not hear the translation in Polish.
Yeah. Mm-hmm.
Okay, thank you. I just heard there was a gap with the translation, so we'll bring that information in again. But the flyer will be shared, as I understand, soon for people to be taken up. Michał, I wanted to turn to you, as you've worked with the health community extensively. What do you think it needs to bring this topic, give this topic more prominence?
Well, I should start with saying that it's not an easy topic, and especially in view what, for instance, Łukasz presented, that economic arguments are very strong in many countries, actually in all countries. There are two issues to mention. One is the provenience, where the wood is coming from in Western Europe. It appears that a lot of it has been, of this biomass has been imported. So now I heard in Germany there are shortages of wood in shops to buy, because the import from Eastern Europe has stopped, or has been stopped. So it will be a problem, and the wood prices will go up again, and there will be more pressure on domestic woods to be cut. So there is a problem on this side. Second aspect of it is technology. There were questions in the chat, and I have shown in the last slides that not all wood is burned in residential setting, in stoves. Indeed, in Germany, it's almost half burned in other installations, which are industrial installations, which are probably, I have no proof on it, but they are probably much more energy efficient, and also are subject to more strict or any pollution emission controls. I mean, this does not, those controls do not affect CO2 emissions, but they do affect particulate matter emissions. So yes, indeed, it depends what kind of installation are used, and either emission treatment process available or not. And looking from this perspective, I come to your question, what should be done, for instance, by health communities? I think the first thing to act is this lowest hanging fruit, which are the fireplaces, open camine. I mean, those fireplaces which are in individual houses and which, as Anya has shown, are actually substantial source of particulate matter. As it was said, it is used very often for recreational reasons. Sometimes it is used an additional source of heat, this is true. And many of us who live in districts or places where are small houses can very well smell the pollution, the air, in theoretically very clean places, like in my case in Bonn. I can feel this, especially on the weekends, and especially when the weather is, let's say, not very pleasant. So people do it, even having normal heating, but do it for fun. And emphasis that a lot of this pollution does not go through the chimney, but stays indoor and affects health of the residents is probably the simplest argument. And this is something which will not solve the problem, but it has two aspects. First of all, if effective this message, if passing through, will save health of those users. And second, it also gives the illustration, the simplest illustration of the hazard, which is combustion of wood. Because if people stop burning wood to save their individual health, they will realize that, okay, I mean, this stuff which goes out of the chimney is affecting the neighbors. And then perhaps in social view, this stops to be treated as a safe way of heating. It does not solve the problem, but at least it increases the appreciation of it and pressure on looking for solutions. Thank you.
Thank you very much, Michał, for these responses and also highlighting where we could start for a change. Vukash, I think you wanted to come in. You had raised your hand.
Yes, thank you. Coming up to what Michał said on the low-hanging fruit, well, coming back to the survey we did, 67% of owners of fireplaces in Mazovia region uses it for recreation. So the biggest issue is compare with biomass compared to the coal, that it is I'm not sure. I think, przepraszam, wydaje mi się, że powinienem mówić po polsku, bo polski jest
I should be
tłumaczony.
speaking Polish because Polish is being translated into English. I kind of forgot which language I was supposed to speak. 67% of fireplace users use it for recreational purposes. 30% as additional one. It is not the problem of poor people, but the problem of status. If you are building a house for 1 million zlotys, you give extra 1,000 zlotys for a fireplace that you use from time to time. Producers say it is not harmful to your health, that it complies with standards that were indicated in my presentation. The element that we were able to cope with in Poland, like diesel, is to make of it as ugly. Diesel, oil is ugly, coal is ugly, harmful. Biomass is beautiful, wonderful, traditional. So we need to replace the adjectives, especially for the new ones. This is a challenge. This is a challenge to change the line of thinking. It takes years to work on, but we need to start with those who do not have to buy a house that is equipped with a fireplace. It's a very difficult start, but still. Well, I'd like to thank for organizing this meeting. This is the topic that we should work on at the European level. It's high time to speak out. It's high time to work because there is lots to do. A car used to be a status indicator. Now it no longer is. Recreation, well, recreational burning, the same applies to fireplaces, and this is just the beginning of the road to walk along. Thank you.
Michał, you want to quickly respond? Yes, please. And then I wanted to
Just
turn to
one.
Vlatka. Yes.
Just one sentence. You can put candles in the fireplace and you have a very nice view and also a little bit of fire. They emit particles, but I think few orders of magnitude less pollution than that. One additional point which was mentioned, the pellets. I think this, and also we had in comments the mentioning of pellets as in some situations a feasible and efficient solution. The question is where pellets come from and what is the composition. Do we have some standardization of pellets, quality control? What comes out of the combustion? If pellets are made from wood residues polluted by some glues or paints and stuff, we don't know what it is, and we really put ourselves and our neighbors in harm. So there's also an area, this on different level, not individual level, but rather industry level, maybe also commission level, to push through the norms and strict execution of those norms. Thank you.
Thank you very much. We have a lot to discuss. We have 5 minutes left, but maybe we can go a bit over because I think there is indeed a lot to talk about. Vlatka, over to you, and then Anya, you're next.
I will be quick. I have a quick point. I wanted to encourage, from a health perspective and from a health professional side, to encourage health professionals to really speak about biomass burning. So there is no biomass burning that is healthy. No matter what kind of wood, no matter what kind of certified, no certified stove, no matter if wood biomass is quantified or nomenclature in renewable directive, it does produce a pollution, it does affect health, and it does affect climate. So we absolutely need to work and be the most ambitious in regards to all of other maybe the professions who are advocating for this or that technology to minimize or to reduce the burden of biomass on health or other or having climate impact. But we are the ones who really can have like a very ambitious target about basically banning the biomass use. This is from health perspective, absolutely unsustainable. So with that, I would just like to encourage everybody to speak openly about that aspect of biomass burning in relation to other cultural side, technological.
Thank you, Vlatka. Anya, you wanted to respond.
Ja, genau. Ich wollte eigentlich das Gleiche jetzt nochmal sagen, was Vladka auch gesagt hat, wenn es um die Technik.
Thank you very much. A similar thing to what Vladka said. We were speaking about technologies, that we need better technologies, that there are attempts in Germany to have some new special fireplaces that should meet standards. Even good filtration techniques will not result in cleaner air leaving the stack. because there'll be more emissions compared to other areas like geothermal sources. Thank you very much indeed.
Thank you, Anya. I'm now handing it over to Veronica.
Proszę Państwa,
Ladies and gentlemen, thank you very much for your voices in discussion. We can see a plethora of questions and they pertain to a myriad of themes. Hardly can we answer all the questions. If given the consent from the speakers, we'll share the email addresses so you can ask the questions directly. But we see the need to continue our discussion. It was the first step. So we'll speak about concrete examples in the next meeting. Legislation, whatever is needed from the point of view of regulations, something that should not be allowed. So closing this webinar, I'd like to express my gratitude for your voices and follow our activities. We'll stay in touch because soon we want to return to discussing this topic, to answer the questions that may not have been asked, because there are many of them. Would have to spend more time. We want to observe the time limits that have been assigned. As mentioned, direct contact with our speakers. Thank you very much for being a part of a webinar. This is the first step in intensification of discussions of biomass burning. What kind of health risks are related? I'd like to thank all the speakers. I'd like to thank all the participants and all HEAL people for their involvement, and the team of interpreters who've been with us, who've made it possible to be comprehended in 3 languages. Observe our media, stay in touch with us. YouTube and social media will be the presentation platforms for the recordings. Presentations, we have already shared the information that, given the consent from the speakers, we'll be more than happy to share them. Thank you very much. Have a good day, and over to Anna again.
Thank you also very much from my side for this exchange. Yeah, I'm really amazed and thankful for all the information that was being shared, also for your discussions. As Veronica said, we didn't have time to address it all, but we definitely want to come back and continue our exchange. In terms of what we can do now, there is a very concrete or tangible opportunity next week with the upcoming vote in ITRE. So again, I encourage you to look into the letter that Anya has shared and contact her, and also seek out other groups, because I know there are also participants here who are working on this. Let's work together with also those the climate groups, the environmental groups, to really give the strong signal that wood burning, biomass burning is not a healthy solution, it's not a sustainable solution, and we need to seek other avenues out there to tackle climate change and to protect our health. And with that, thank you again to our speakers for your excellent contributions, to our translators, and to the HEAL team. And we'll be in touch with everyone. Have a good rest of the day.